Hello friends, this is Dr. Kaushik Sundar, stroke and interventional neurologist at RN Tagore Hospital, Kolkata. Today when we are talking about a little bit about stroke management. When we talk about stroke management, what I would like to say is stroke management is at 4 different levels. The first level is called an acute treatment. That is the moment the patient has a stroke, then what do we need to do? So you have to rush him to the hospital in a particular time, that is called the golden hour, because in that time we can actually try and reverse the effects of stroke. The 2 major techniques that are used to reverse this effect is thrombolysis, where we give a drug to dissolve the clot, or mechanical thrombectomy, where we go inside and remove the clot and the patient survives. This is quintessential to see that the stroke patient improves. After this acute phase, the next phase is the ICU phase, where after an acute stroke, the patient is shifted to an ICU and the first 2 to 3 days are going to be very critical. The patient can have bleeding during that time. The patient can have huge edema, or a patient can get a brain swelling during this time. And at this time, other organs might also fail. And it is very important that the patient remains in the ICU for those 2-3 days, where our ICU based doctors manage his stroke. The third point is the patient when he comes to the ward. And during that time, the assessment for stroke and also other medications that are required to support his stroke treatment is given till he is discharged. And finally, the most important part of stroke care management is rehabilitation. And when I say rehab, I say that in this part, the family members become doctors themselves, because they have to show their tender loving care to the patient and help them to do all the rehabilitation activities at home. So remember this, stroke management is not just bringing the patient to the hospital, it is acute care where the patient reaches the hospital in good time so that we can remove the clot or dissolve it. Second is the ICU care, where we have to wait and see that the other organ systems are taken care of. Then the ward, where the patient is general stroke treatment is given and patient is slowly mobilized. And finally rehab, where the patient starts becoming independent. So I request you to understand and read more about stroke, and please help us help you. Thank you.